watching Quad Cities Live.
Joint pain, it can affect every part of daily life, from simply walking around the house to staying active and doing the things you love. But for many, joint replacement surgery offers more than just relief. It allows patients to return to living fully. And thanks to major advances in technology, patients are now recovering faster and feeling less pain. So here with answers to all of our questions today is Erica Hayes, the Regional Director of Surgical Services at UnityPoint Health Trinity, and Dr. Brian McGowan, who is an orthopedic surgeon at Orthopedic Specialists. Thank you both for being here today. We appreciate it.
Thank you for having us.
Yeah, I just absolutely love these segments because, you know, there are folks out there who have questions or who are dealing with pain and they don't feel comfortable potentially going, I don't know if I really need to see a doctor quite yet. And there's a lot of people sitting at home watching that this information is going to be very useful to them. So Dr. McGowan, talk more about the primary reasons that, you know, somebody might need joint replacement surgery. Like, at what point should they consider this?
Yeah, so the main reason for doing a joint replacement, whether it's your hip or your knee, is for arthritis. And arthritis is wearing away the cartilage in your joints. Okay. A lot of factors play into that: your metabolic health, your joint alignment, your activity level, your genetics play into it as well. But the end result is wearing away the cartilage in your joints. And when that gets severe, that can lead to pain, stiffness, decreased motion, swelling, and when those symptoms start to impact your function, your quality of life, your daily activities, that's when it's time to think about talking to an orthopedic surgeon about considering a joint replacement.
Absolutely, and I got to ask, I mean, how many patients do you talk to who, you know, really, they put it off? Like, you kind of get used to dealing with it, you know?
Yeah.
You get used to the discomfort and the pain, and, you know, do you ever go, like, it doesn't have to be that way?
Yeah, you know, just because you have arthritis doesn't mean you have to have a joint replacement, but, you know, again, when it's impacting your function, your quality of life, and the things short of surgery, like anti-inflammatories, activity modification therapy, when those fail to really control your symptoms, that's typically when it's time to think about doing a joint replacement.
Absolutely. Yeah. Okay, so Erica, describe the joint replacement procedures that are offered through UnityPoint Health Trinity.
Sure. So UnityPoint Health Trinity offers total and partial knees, hips, shoulders, ankles.
Wow.
The whole gamut.
You got the whole menu.
Right, yes.
Okay, and it includes robotic surgery.
Correct.
And actually, you guys are kind of pioneers in the area when it comes to that.
Correct, but UnityPoint Health was the first and the only hospital in the Quad City area that utilizes the Mako robotic surgery.
Okay, is that what we're seeing here on the screen?
Correct, yes.
Okay, cool.
Yes, so it offers that advanced surgical technology, and when you come and see us at UnityPoint, it provides our teams, our experts in the areas to provide that advanced technology close to home.
That's great. Dr. McGowan kind of explained how robotic-assisted surgery works. I mean, what is the real benefit here for patients, but also for folks like yourself or medical staff?
Yeah, you know, it's been a powerful tool in joint replacement, and what we do is we get a CT scan of your joint beforehand. We create a 3D model of that, whether it's your hip or your knee. During surgery, we're able to take measurements, and then we're able to input those measurements in the computer, the robotic computer, and basically create a customized patient plan for your joint, and then execute that plan within millimeters of accuracy, and really get the implants exactly where we want them.
That's great.
So it's, you know, reassuring for the surgeon knowing things are going in exactly where you want them to go. You know, the long-term benefits for the patients are still being studied, but the goal is to, with our improved accuracy of component placement, improve patient function and longevity of the implants.
Yeah, the more accurate, the better. I mean, you know, you talk about it from your perspective, it being a medical professional, but from the patient as well. You have to imagine that they would, you know, love that option. And Erica, speaking of patients, with these medical advancements, like the robotic surgery, many of these patients can go home the same day that they have their replacement surgery.
Yes. So if they do meet the qualifications and the criteria, they are able to go home that same night after surgery.
Wow.
We know that the best place for patients to be is at home with their families, around that care and that support and their loved ones, and so that promotes the rest and relaxation that they need to recover in the comfort of their home. So
depending on how old their kids are.
Correct.
Some of us would opt to stay. No, I'm just kidding, absolutely. But that is truly amazing. You wouldn't imagine being able to talk about that people would have a surgery and then be able to head home, later that day. That's got to be reassuring to a lot of folks who are maybe a little bit nervous about it. And speaking of understanding what to do before, during, and after surgery can be overwhelming for people. I can only assume that's why people wait so long sometimes to call or make that appointment. But Trinity actually helps people prepare. You offer a little workshop of sorts.
Correct. We do offer our Total Joint Boot Camp, which is really an opportunity for patients to come in and kind of learn what happens through the whole surgical process. It talks about your pre-op, what you're going to experience on the day of surgery, what you're going to experience for recovery. It goes through the whole process from beginning to end. We also bring in our physical therapy experts and have them talk to the patients. They can talk about pain, post-op pain control, what the expectations are for recovery, how to, pain management strategies, and really that helps the patient then feel more comfortable when they come in on the day of surgery. They know what to expect.
Yeah.
They also have excuse me, have an opportunity to understand how to prevent being readmitted to the hospital, really looking at their strategies for how they are when they go home.
That is
how they can help their recovery.
Yeah, I mean, patient outcomes. I mean, that makes all the difference in being prepared. It's like you get done, you go home the same day, and you know what medications are right for you. You know when you're going to be going to like PT and things like that, and how many times, and what you might be doing when you get there. So kind of leaves no stone unturned in that way. And Dr. McGowan, you actually brought an example of some joints with you.
Yeah, so this is an example of a knee that would be put in with the Mako robot, and with this, we make these 5 cuts on the femur bone or your thigh bone, and then 1 cut on your tibia. And what the robot does is, the saw comes in on an arm and it makes those cuts exactly where you plan them to be. So that's kind of the advantage of using the robot, is just getting that surgical precision and consistency.
Yeah, that's wonderful. Well, for more information on joint replacements and orthopedic surgery, just visit unitypoint.org. Lots of information on the website. We'll, of course, link you specifically to that page on our website. Erica and Dr. McGowan, thank you so much for taking the time to join us and just answer everyone's questions.
Thank you.
Thank you for having us.
Absolutely.